Let's take a look now at some disorders that involve movement. We'll start off with Parkinson's disease. Symptoms of Parkinson's include a tremor at rest. Now this is an important thing to distinguish here. Other conditions will result in a tremor, but not a tremor at rest. And what a tremor at rest means is that the hand or other parts of the body will have the tremor, will shake, but only in between movements. So if a person is writing their name with their hand, at that moment there will not be a tremor, but as soon as they stop writing their name, the tremor will resume. That is a hallmark of Parkinson's disease, and it's, again, very different from what you see in other age-related or neurodegenerative conditions that result in a tremor. That's sometimes called an essential tremor. An essential tremor would be a tremor that you can see, for example, in the person's handwriting, that it will no longer be smooth. It'll be kind of choppy because of the tremor. So a tremor at rest in between intentional movements is a hallmark of Parkinson's disease. In addition, rigid muscles are a factor, and the person will, so the rigid muscles are out in their body, the arms and legs and so on. But the face muscles and sometimes the muscles around the throat will be very slack and kind of too relaxed. They experience difficulty in moving, but especially in initiating movements and getting them started. And so one of the curious things about Parkinson's disease is that a person, for example, might be at an intersection unable to walk across the street or initiate going across the street, but if the person behind them pushes them a little bit or pretends to trip them or in some other ways triggers like a reflexive reaction, bam, they will be able to walk normally. The cause of Parkinson's is a loss of dopamine in the brain because of what are called Lewy bodies, or more commonly because of degeneration of the substantia nigra. The substantia nigra, remember, is one of our main sources of dopamine for the brain, and it sends dopamine up to the basal ganglia, and then the basal ganglia in turn controls the motor cortex. So let's take a look at how that works. Here in the midbrain, we can look at a section of the brain, and we see that the midbrain is deep in the brain. It's that inner core of the brain. The substantia nigra literally means the black substance because the neurons there have a dark pigment. And in the case of Parkinson's disease, the individual will lose up to 70% of those neurons, resulting in that section of the brain, the substantia nigra, no longer appearing to be as dark anymore because those neurons have died. The substantia nigra, again, down here in the midbrain, is one of two main sources of dopamine in the brain. The neuron cell bodies are in the substantia nigra. Their axons then deliver that dopamine to the basal ganglia. And remember, the basal ganglia consists of actually three structures. It consists of the caudate nucleus, the putamen, and the globus pallidus. And then the globus pallidus sends its axons up to the motor cortex and regulates the activity of the motor cortex, and it does so by inhibiting the motor cortex. So it sends inhibition. And so that's why we see here a little minus sign, not a plus. The loss of these dopamine-producing neurons in the substantia nigra disrupts the normal flow of information from the basal ganglia to the motor cortex. Normally, there is both excitation and inhibition of the motor cortex, and they kind of balance each other out. But with the damage to the substantia nigra, with the loss of dopamine, that means then that it disrupts the functioning of the basal ganglia and leads to too much inhibition of the motor cortex. In addition, there are inputs from the basal ganglia to the thalamus that also get affected, and that leads to the tremor. And so the loss of these neurons that make dopamine leads to excessive inhibition of the motor cortex, and that leads to the symptoms of a difficulty initiating movement because of that extra inhibition. And in contrast, remember the disruption here on the thalamus leads to the tremor. So let's take a look at some of the causes of Parkinson's disease. Genetic influences are more likely with early onset Parkinson's, but in most cases, there don't seem to be any gene-related factors. So Parkinson's is generally not a hereditary condition. There are, however, environmental influences. It may be caused by subtle brain injury, so a greater number of concussions is associated with a higher risk for Parkinson's disease. Also, exposure to toxins like carbon monoxide, herbicides, and pesticides are known to increase the rate of Parkinson's disease using epidemiological research. Interestingly, caffeine indirectly increases dopamine levels and acetylcholine and reduces the risk by about 80%. Huntington's disease is in some ways really the opposite of Parkinson's. It is heavily influenced by genetics and it is highly heritable. It's a degenerative disorder of the motor system, so it certainly influences movement. Here, the loss of neurons happens in the basal ganglia. So whereas in Parkinson's it happens in the substantia nigra, we lose the input of dopamine. Here, we're losing the neurons that make up the basal ganglia, in particular the caudate nucleus, the putamen. There's also loss of neurons in the nucleus accumbens and throughout the cortex. So there is general loss of neurons throughout the cortex, not just in these areas. The motor symptoms include writhing and grimacing, a lot of really unwanted movements that are the result of the degeneration of neurons in the basal ganglia. Other symptoms, though, because there are other areas of the brain that are affected, include cognitive impairment, depression, personality changes. The loss of neurons is caused by a dominant mutation in the Huntington gene. So this is the gene that results in the production of Huntington protein. There is a promising anti-glutamate drug that may prevent cell death from overstimulation, but otherwise the only approved drug reduces dopamine levels and attempts to help with some of the symptoms. Here we can see some of the large amount of brain tissue that is lost in the case of Huntington's disease. We can see an extremely enlarged ventricle. Notice that the sulci in the brain are kind of enlarged compared to the control brain, and that's another sign that there's just been a lot of widespread loss of neurons. But this is really, really large loss of the basal ganglia we see here on the left, and intact. It is pretty much very badly affected in the case of Huntington's disease. Because it is due to a dominant gene. Inheritance of the gene will lead to development of Huntington's disease. So there is a genetic test that can be done, and it will determine that that person will develop Huntington's. Huntington's typically develops in the 30s and 40s, so it tends to hit people earlier in life than Parkinson's disease, and it can be really challenging and very difficult. Myasthenia gravis is a condition that results in muscular weakness. It's caused by a loss of acetylcholine receptors or a decrease in the sensitivity of those acetylcholine receptors. And these are the receptors on the muscle fibers that are necessary for the neuromuscular junction to receive that signal from the brain to initiate movement. We can see in this picture that the eyelid is not able to stay open in this case, and acetylcholinesterase inhibitors, so drugs that inhibit the breakdown of acetylcholine, are able to increase acetylcholine levels in the synapse and give some temporary relief. So these would be acetylcholine agonists. Myasthenia gravis can be treated through a thymectomy, removal of the thymus gland. This completely eliminates symptoms in almost 80% of patients. This decreases the number of lymphocytes that produce antibodies, which are involved in the reduction of those acetylcholine receptors. Multiple sclerosis is caused by a deterioration of myelin, in other words, demyelination, and also loss of neurons in the central nervous system. In this image here on the right, you can see where these arrows are pointing. This is basically scar tissue, and that's where the term sclerosis comes from. It creates scar tissue in the white matter of the brain, because the white matter, of course, is the myelin. It means that the neurons are not able to send signals as effectively as before because of the loss of the myelin. It reduces the speed and the strength of movements, and the demyelinated neurons die, leaving hardened scar tissue, which we see here. It can be triggered by an earlier viral disease such as Epstein-Barr, mumps, or measles. And drugs modify immune activity and slow the progress of the disease, but they don't repair the harm that's already been done.